So good day, Ma'am Maika. Today, I want to talk with you about something that many people experience. Often silently panic attack, they can feel very sudden and intense, like your body is reacting to danger. Even when there's no clear threat, you might feel your heart pounding, having trouble breathing, or feel like you're losing control. So for you, Ma'am Maika, what is your experience in panic attack?
So for me, panic attacks is something that I sometimes experience. So it is a sudden episodes of fear and sudden episodes of discomfort. So it's so hard for me to breathe, and I have a pain in my chest.
So it is important for you to know that you're not alone in this. What you're feeling is real and it's something we can work together. My goal today is to help you understand what a panic attack is, learn how to recognize the signs early, and show you some ways to cope when it happens. Um, next. Next slide is panic attacks often come on suddenly and intensely without any warning. You might feel an overwhelming sense of fear or discomfort, and it can seem like something is terribly wrong even if there's no actual danger for you. So, Mamaika, you can feel that sometimes in your hyperventilation. Okay. So, this episode usually peak within a few minutes, meaning the symptoms reach their strongest points fairly quickly. It might feel like your heart is racing, you can catch your breath, or you're losing control, but the body is actually going through the stress response even though there's no clear cause or threat. So because of this and physical feelings or panic attacks can feel very frightening, it's common for people to worry that they're having a heart attack or that something serious is happening, but this sensation, though very real, are not life-threatening. Okay, so next is how it feels. So first is racing heart, next is shortness of breath, third is chest pain, and fourth is fear of dying or losing control. So when you're having a panic attack, the physical sensation can be very intense and alarming. You might feel your heart racing, almost like pounding out of your chest. It can become hard to breathe as if you can get enough air. So you can feel that, ma'am? Yeah. Okay. So some people feel chest pain or tightness, which can be especially scary and make them worry something is wrong with their heart along with the symptoms. So it is very common to feel a deep sense of fear, sometimes even a fear of dying or a feeling that you're losing control or going lazy. All of this can feel overwhelming in the moment, but it's important to remember that these feelings are very real and frightening, are part of your body's fight or flight response, and they will pass. So next is what is the cause of panic attack. So first is stress, anxiety, trauma, genetics, and substance use. So when panic attacks happen, it can feel like your body is going into overdrive. Common sensations include racing heart, shortness of breath, chest pain or tightness, fear of dying or losing control. So the meaning of racing heart is your heart may beat very fast or hard, which can feel alarming and make you think something is wrong with your heart. So that you can feel it, ma'am? Okay. Next, shortness of breath. You might feel like you can get enough air or that breathing is difficult, which can increase anxiety even more. Okay. Chest pain or tightness. This can feel sharp, heavy or squeezing and is often mistaken for a heart attack.
Yeah, that's what I experienced last month.
Okay. Next is fear of dying or losing control. Many people feel an intense fear that something terrible is about to happen, like they're going to pass out, lose their mind, or even die. These sensations are very real and very scary, but they're also temporary and part of your body's natural stress response. With the right tools, you can learn to manage them and feel more in control. So next is stress and trauma. Panic attacks can be triggered by different factors and sometimes they seem to come out of nowhere. Here are some common causes. First is stress, anxiety, trauma, genetics, substance use. Ongoing stress from relationship or life changes can build up over time and trigger panic attack. So, ang stress is maka-trigger siya sa panic attack. Next is anxiety. People who live with anxiety disorders are more likely to experience panic attacks, especially when their anxiety becomes overwhelming. Next is trauma. A past traumatic experience like abuse, an accident, or major loss can lead to panic attacks, especially if the trauma hasn't been fully processed. Next, genetics. Panic attacks can run in families, so if someone in your family has experienced them, you might be more likely to as well. Last is substance use. Caffeine, alcohol, certain medication, or drug use can sometimes trigger or worsen panic attacks. So, ma'am, what types of stress these five can cause your panic attacks?
Maybe substance use.
Why?
Because I'm fond of drinking milk tea, especially soft drinks. Because of course our weather right now is so hot, so that's why I'm being tempted to buy, and that causes my panic attacks.
Okay. So it is important to remember that panic attacks are not your fault and there is help available. Understanding what might be contributing in the first step toward healing. So next is both stress and trauma can play a big role in panic attacks. So when you're under high stress, whether from work, relationship, health issues, or major life changes, your body stays in a constant state of alert. This can make you more sensitive to anxiety and raise the risk of panic attacks. Trauma, especially from events like abuse, accidents, or loss, can leave lasting emotional effects. Sometimes the body remembers that fear even if the mind tries to move on. This can lead to panic attacks, especially when something reminds you consciously or not of that trauma. If you're already dealing with ongoing mental health challenges like anxiety, depression, or PTSD, your system may already be feeling overwhelmed. This can increase your vulnerability to panic attacks when stress builds up. So the good news is that healing is possible with support and the right tools. You can learn to reduce the impact of stress and work through past trauma in health ways. So next is mental health connection. So mental health connection is panic attacks are often closely linked to other mental condition. Understanding this connection can help you feel less alone and more empowered to manage what you're experiencing. Anxiety, panic attack are commonly symptom or anxiety disorders. When your mind a constant state of worry or tension, it can lead a sudden spikes in fear, resulting in a panic attack. Depression. People with a depression may also experience panic attacks, especially when feelings of hopelessness or overwhelm become too much to handle. Post-traumatic stress disorder, PTSD. If you've experienced trauma, your body may react strongly to triggers even once you may not be fully aware of, leading to panic attacks as part of PTSD. Substance use disorder. Drugs and alcohol can affect brain chemistry, increase anxiety, and sometimes directly cause panic attacks, especially during withdrawal or overuse. So if you're dealing with any of these conditions, it doesn't mean something is wrong with you. It just means your mind and body are under strain, and with right care, this can improve. So next is flight or flight response. Body survival system, physical changes during panic, often activated without real danger during panic attacks. So when you're experiencing a panic attack, what's really happening is that your body fight or flight response is kicking in. So this your body's natural survival system designed to protect you in dangerous situation. When the brain senses a threat, it sends signals to the body to either fight or escape. This causes physical changes like a racing heart, rapid breathing, tense muscles, sweating. So racing heart is to pump blood to your muscle. Rapid breathing to get more oxygen, tense muscles to prepare for action, sweating is to cool to your down quickly. So this is the four response are helpful if you're actually in danger, like facing a wild animal or trying to avoid an accident. But during a panic attack, this system is activated without a real threat, which makes the symptoms feel confusing and scary. Understanding that it's your body trying to protect you, but reacting at the wrong time can help you feel less afraid of the sensation and more in control when they happen. So this is the technique in your depth breathing. So breathing and grounding technique. So first is the deep breath to calm the body. This helps slow down your heart rate and tells your brain you're safe. So first is breath in slowly through your nose for 4 seconds. So let's do that, ma'am. Breath in slowly through your nose for 4 seconds. Ready, start. 1, 2, 3, 4. So next is hold your breath for 4 seconds. 1, 2, 3, start. 1, 2, 3, 4. So next is breath out gently through your mouth for 6 seconds. So ready, start. 1, 2, 3, 4, 5, 6. So repeat for this for 1 to 2 minutes or until you feel calmer. So can you feel it? So the tip is place one hand on your chest and one on your stomach. Try to breathe so that only the hand on your stomach rises. This signals deeper calming breath. So this is the tip. So the next one is grounding stick technique to calm the mind. 5, 4, 3, 2, 1. This brings your focus away from fear and back to the present moment. So 5 things you can see, ma'am. Look around and name that. So you can see it, ma'am. Please name that. What you can see.
Fan, mirror, printer, laptop, and a plate.
Okay, thank you, ma'am. So, for things you can touch, feel the texture, clothes or chair. So, what for?
Pillow, there's rock, table, then my cell phone, this one, this tray.
Okay. So, ma'am, three things you can hear. What you can
The
hear?
fan, and my cell phone as well, the vibrate, and the sound of a bird.
Okay. So, next is two things you can smell.
The smell of this room, and the smell of the pillow.
So, next is one thing you can taste. Your favorite flavor.
Sweet and sour.
Okay. So, this helps ground you when your mind is racing and reminds your brain that you're not in danger right now. So, ma'am, your mind is relaxed right now?
Yeah.
Okay. Next is what happens in the body during a panic attack. So when you have a panic attack, your body is reacting as if you're in a real danger even if there isn't any. Here what happens. First is your brain signals danger. The part of your brain responsible for survival, called the amygdala, sends an alarm to your body even if there's no real threat. Next is adrenaline rush. Your body releases adrenaline, a stress hormone that prepares you to fight or escape. Third is fast heart and breathing. Your heart starts to race and your breathing speeds up to get more oxygen to your muscle. This can make you feel dizzy, lightheaded, or short breath. So all of this is part of your body's natural response to stress. It's designed to protect you, but during a panic attack, it gets triggered by false alarm. So the key is it's not dangerous even though it feels intense, and with practice you can learn how to calm the system down. So next is common triggers for panic attacks. Panic attacks can sometimes feel like they come out of nowhere, but there are often triggers, things that set off the body's stress response. So there are some common ones include life changes, conflicts, illness, substance use. So understanding your personal triggers can help you become more aware of what your body is reacting to and take steps to manage or avoid those situations when possible. Next is risk factors for panic attacks. Some people are more likely to experience panic attacks than others, and this can be due to a combination of factors. This includes family history, sensitive temperament, early trauma, major stress. So family history is panic attacks or anxiety disorders run in your family. You may be more likely experience them yourself due to genetics and learned behavior. Sensitive temperament is some people are naturally more sensitive to stress, emotion, or physical sensation, which can make them more reactive to anxiety. Next is early trauma. Experiencing trauma in childhood such as abuse, neglect, or loss can increase sensitivity to stress and fear later in life. So the last one is major stress. Going through intense or going stress like financial struggles, caregiving, or health problems can put extra strain on your body and mind, making panic attacks more likely. So, ma'am, what for your in your feel in your four risk factors of panic attacks?
Maybe one of that is sensitive temperament.
Mm-mm.
Major stress.
Okay. So these risk factors don't mean panic attacks are guaranteed, but they do help explain why they might be happening, and most importantly, they can be managed with the right support and strategies. So these are the treatment options for panic attacks. There are several effective ways to treat panic attacks and reduce often they happen. Therapy, medication, lifestyle changes, relaxation techniques. So first is therapy. Cognitive behavioral therapy is one of the most effective treatments. It helps you understand your thought patterns, manage anxiety, and face fears gradually. Trauma-focused therapy may be helpful if past trauma is a trigger. Medication. In some cases, medication like SSRIs, antidepressants, or anti-anxiety medication can help reduce the frequency and intensity of panic attacks. These are often used alongside therapy and prescribed carefully based on your needs. The third one is lifestyle changes. Regular exercise, healthy sleep, and balanced nutrition can strengthen your nervous system and reduce overall anxiety. The fourth one is relaxation techniques. Deep breathing, mindfulness, and progressive muscle relaxation can help calm your body before a panic attack fully develops. Practicing this daily makes them more effective over time. So these are the prevention tips, ma'am. Know your triggers, build a routine, seek support, act early. So know your triggers, keep a journal or log of when panic attacks happen and what might have led up to them. Build a routine. A steady daily routine helps your body feel safe and grounded. Third is seek support. Talk to someone you trust. Join a support group or work with a mental health professional. Act early is the last one. Learn to recognize the early signs of anxiety and use coping skills before it builds up. So these are the prevention tips, ma'am, in panic attacks. So next is related health condition. Sometimes medical condition can cause symptoms that feel similar to a panic attacks, or they may increase your risk of having one. It's important to understand this connection. First is asthma. Trouble breathing during an asthma flare can feel like panic, and the fear or not getting enough air can actually trigger a panic attack in some people. So, number 2 is diabetes mellitus. Low blood sugar, hypoglycemia can cause shakiness, sweating, and a rapid heartbeat symptoms that overlap with panic attack. Managing blood sugar carefully can help avoid confusion between the two. Next is hyperthyroidism. An overactive thyroid speeds up the body processes and can lead to anxiety, a racing heart, and restlessness, which may trigger a mimic or a panic attack. So, ma'am, panic attacks, hindi siya nag-cause ng mga stress or anxiety. So, may tatlo ding related health conditions sa panic attacks like asthma, diabetes mellitus, and hyperthyroidism. So So if you have any of this condition, ma'am, it is important to work with both your medical doctor and mental health provider to get a clear diagnosis and the right care. Sometimes treating the underlying physical condition also reduces panic symptoms. So when you seek medical help, if you're unsure whether you experience a panic attack or a physical health condition, or if you have a history of this condition, contact your healthcare provider. They can help you determine the cause and get the right treatment. Okay. So next is coping strategies for panic attacks. So first is mindfulness, breathing exercise, talk to someone, and counseling. So the meaning of mindfulness is focusing on the present moment without judgment. It helps you stay grounded by paying attention to senses of your thoughts without getting caught up in them. Then simple techniques like body scanning or observing your surroundings can help you regain a sense of control and calmness. So next is breathing exercise. So deep breathing is one of the most effective ways to calm your body during a panic attack. So try the 4-7-8 breathing technique. Inhale through your nose for 4 seconds, hold for 7 seconds, and exhale through your mouth for 8 seconds. So ma'am, let's do this 4-7-8 breathing technique. So first is inhale through your nose for 4 seconds and hold for 7 seconds, then inhale through your mouth. Okay, let's do it now. 1, 2, 3, go. 1, 2, 3, 4, and hold. 1, 2, 3, 4, 5, 6, 7. Exhale to your mouth. 1, 2, 3, 4, 5, 6, 7, 8. So this helps slow down your heart rate and signals your body to relax. So number 3, ma'am, is talk to someone. Reach out to a trusted person. Sometimes just talking about what your experience can reduce the intensity of panic attack. Let them know what you're feeling so they can offer reassurance and help you focus on calming down. So mom, you can talk to someone that you are comfortable with and trusted person. So next is counseling. Therapy can be a powerful tool for understanding and managing panic attacks. Cognitive behavioral therapy (CBT) is effective in helping you identify the challenge, the thoughts and patterns that lead to panic. A counselor or therapist can help you build a toolbox of techniques to cope with anxiety and panic. So the last one, ma'am, is counseling. So remember these 4 strategies, ma'am: mindfulness, breathing exercise, talk to someone, and counseling. So these strategies take time and practice to become effective, but the more you use them, the easier it will be to manage panic attacks when they occur. So ma'am, I prepare some questions to answer this one. So ma'am, can you please answer me?
Kanya ko lang
Yes po.
Ito pa na akong college.
Wala na. ma'am. Thank you for answering.
Thank you.
So, ma'am, before we end, I have conclusion for you. So, panic attacks can be overwhelming and frightening, but with the right understanding and coping strategies, you can manage them. It's important to remember that panic attacks, while intense, are not dangerous. They are your body's natural reaction to stress and anxiety, and with practice, you can learn to reduce their impact. So, by using techniques like deep breathing, mindfulness, and grounding exercises, you can regain control during a panic attack. Seeking support through therapy or talking to someone you trust can also provide invaluable assistance in overcoming these challenges. So if you are experiencing panic attacks, know that help is available, and you don't have to face it alone. Together we can work on building the tools you need to feel more confident and in control of your health and well-being. So remember, healing takes time, and every small steps forward in progress. So ma'am, I hope you understand something in my lecture. So ma'am, do you have any question?
And so far, I just learned so many things on how I can manage my hyperventilation when it happens, and how and the things that I need to do for me to avoid this kind of pain as well.
So ma'am, thank you for your time, and so if you have any question, you can contact me. So ma'am,
Thank
I
you.
have brochure for you, so if you can you have question, you can look at this.
Okay,
So,
thank you.
thank you ma'am. Thank you for listening. Bye.